For the next session, we warmly welcome our next captivating speaker, respected Dr. K. Muthu Pratiba ma'am, to exchange her ideas, explore the innovations on a very challenging topic. We would like to welcome the chairpersons of the session, respected Dr. Kanagavalli ma'am, HOD and Professor of Department of Anatomy and Dynamic MU Coordinator, to introduce the speaker, and Dr. Banu Gopanar sir, Associate Professor, Department of General Medicine, Government Thiruvannamalai Medical College. Like in
Good morning to one adult present here. Before introducing today's speaker, Dr. Muthu Prathibha ma'am, I just want to share a small story which happened in our department yesterday. I was discussing what is the final objective of this MU for students as well as for faculties. Any of us really we are doing something to our students and something for ourselves for faculties. We had a discussion, ma'am, in our department. And one of our faculty, she came with a ma'am, no, really, I saw one professor. She is inspiring the students, and she's educating and training the students in research. And she told your name, Prathibha. So it is very nice to see you. It is my honor to introduce you, ma'am. Madam Dr. Muthu Prathibha is a professor and head Department of Physiology, SRMC, and Madam is a Phase 1 member of UG Curriculum Committee and member of MU Nodal Center. And Madam is a member of Library Committee, Grievance Redressal Committee, SRMC. And Madam has an experience of 18 years, both in teaching as well as research. And Madam has 22 publications. And Madam have been awarded with Best Teacher for Phase 1 MBBS in 2019, 21, and 22. And Madam have authored Rosen Wilson Anatomy and Physiology in Health and Illness and Best and Taylor's textbook for Physiology. And Madam is reviewing Indian Journal of Medical Ethics. The dais is yours, ma'am. Thank you.
Thank you so much, ma'am. Thank you, sir. Good afternoon, everyone. Sorry, my throat is not at the best of its forms, but I'm going to try and speak as much as I can. A happy afternoon. I start with this favorite picture of mine. It's a story of the Greek mythology where you have King Odysseus, who handed over his son Telemachus to his best friend mentor. King Odysseus went to the Trojan War, and therefore he wanted somebody to take care of his son Telemachus. So he appointed his friend mentor. And when he came back from the war, Odysseus was so happy about the way Telemachus has evolved into, not just in taking care of the kingdom, but as a person himself. There's an additional mythological story that Athena, the goddess, came disguised as mentor and also offered spiritual guidance to Telemachus. So that is mythology. So I'm so thankful to mentor, from whom this term mentoring came, and from where I got the opportunity to talk to all of you about a topic that is so close to my heart. Thank you, DEEPAM Medcon. And Priscilla is not here. She's gone to send off Sudha ma'am. Thank you, Priscilla, for having me here. Thank you to all my mentors and mentees because of who I am, what I am today. And thank you to a little girl, Mayuri, who's been taking care of me really well today as a volunteer. She got me tea, she got me hot water, and then she helped me with my bags and everything. Thank you to her also. So with all the gratitude to all my loving teachers and professors and mentors and seniors in the field of physiology, I do not plan to do this. As Sudha ma'am addressed, and as I saw all of you, I'm sure we've gone through multiple sessions on the nuts and bolts of mentoring, at least the theoretical parts. So I'm not going to define a mentor, mentee, roles, responsibilities, stakeholders, the NMC guidelines, which are thrust into us whether we want or not. What I intend to do together with this lovely little gathering for the next 30 minutes is probably to reflect, discuss, and share views on mentoring the future generation. Many a times today, we heard the words Gen Alpha, Gen Z. So I requested Priscilla when she asked me, can you talk on mentoring? I told her I've spoken about what is mentoring, current insights, mentoring medical students. I want to talk, and I requested the topic from her, the way forward. And yesterday at the dinner table with all the speakers, we had conversations for almost an hour as to how difficult it is to mentor our students these days. No one is bad here, but the difficulty is the truth. So the challenges we may encounter, tackling special circumstances, agreeing to disagree and embrace differences, and most importantly, if you decide to thoroughly enjoy mentoring at the end of this lecture, my job is done. So, mentoring the way forward, this lecture is inspired by my encounters with the most magnificent mountain, the Arunachala, and the most wonderful mentor, Ramana Maharishi. So every time a guest lecture is allotted, you start thinking, how do I frame this lecture? What do I base it on? How do I make it interesting? How do I make it thoughtful? And so I decided to share my story with you, a story that happened about 8 years ago. So I live with my partner, who is a professional mountain climber, and my little daughter, who is 14 years old. So when this happened, she was about 7 years old, and this was my first bike road trip to Thiruvannamalai. So I had purchased this scooter. It was brand new. It was very powerful, and I love riding two-wheelers. And so I thought, why not a long ride all the way to Thiruvannamalai? I had not taken a long ride in the two-wheeler until then. It was challenging, but I thought I'll do it. And so we rode all the way from Chennai to Thiruvannamalai, exchanging my daughter between each other. So he was on his bike, I was on this scooter, and she was sitting behind us. And we came down and we settled down. And then we thought, why not climb the Arunachala? So I have gone until Virupaksha, but I have never had the joy of climbing the Arunachala mountain. I hear that it is banned now, but at that point, permissions were given. So we decided to climb the mountain Arunachala, and we settled down in a resort the previous night, a very quaint homestay. In the previous night, I was silent. I was excited to climb Arunachala, but it was very surprising that I did not have any questions. On the other hand, my daughter had at least 50 to 60 questions thrown to my partner, one after another, and he was patiently answering them. What is in store for the mentor of Gen Z or Gen Alpha? You have truckloads of questions to answer, trivial to abstract questions. They have no fear. They have less inhibition to ask questions, or sometimes they lock themselves in silence and they do not ask any questions at all. May I request the students to please maintain some silence? Students? Yes. So based on the prior superficial exposure that they have in their little life that they have lived, and with the heavy influence of social media, they come to you with questions. But I believe every successful student was once a curious student who asked a number of questions. A lot of anatomists and physiologists here, I'm sure they would have come to you with some questions like this. We might be the head of the medical education unit, head of the department, a senior professor, but we still face questions like, ma'am, which textbook should I buy? How am I going to cover such a huge textbook? I'm not able to cover the portions. And they come with this stunning question. What is important, ma'am? Should I score marks or should I know the concepts? From then, along the first year, or if they travel with us until they finish their internship, and some of them travel their entire lives with us, they ask serious questions like, isn't it impossible to know everything? They want you to clarify doubts on hope of dying patients. Sometimes they come and ask me, why did you choose teaching? Why not clinical practice? They want to know how much of importance would you give to making money? Can I have a baby? What do you think about getting married? What do you think about a broken relationship? They look up to you for questions that we don't imagine sometimes. So, besides being a wise guide, a coach, a teacher, the scope for mentoring is wide and more. We help them in honing their academic performance, clinical skills, guidance for research, a lot under the umbrella called hidden curriculum, emotional guidance, and at times personal and professional counseling too. So if you decide to be a mentor, then let us begin with the understanding that the scope is only wider, and beyond that. So what is this? I just searched a picture in Google called Gen Z language. And I see my daughter using one or two of them, my little niece using almost all of them. But then guess what? I didn't bother to find out what these words mean, because taking inspiration from Ramana and the mountain Arunachala, certain things are timeless. The languages of kindness, empathy, and care from a mentor can help you communicate to any sort of mentee. So at this juncture, taking the words of Ramana, I would like you to say, practice deep listening without agenda, create the space for mentees to be truly heard and truly understood. So for those of you who do not know about Arunachala, it is about 814 meters and about 2,671 feet in height. It is a part of the Eastern Ghats, and it is very famous also because of Ramana Maharishi, who is the master of self-inquiry with the question, who am I? So I'm going to pause here, no slides, take about 5 minutes and talk to you about my climbing experience of the mountain Arunachala. So we obtained prior permission, and then we spoke to one of the persons who can help you with the climb, which was Mani Anna. So Mani Anna is part of the mountain. The mountain is a part of him. Mani Anna is a native of Thiruvannamalai, and he is part of the group of people who go to light the DEEPAM on the day of Kartige DEEPAM. So we spoke to Mani Anna. He speaks very less. He said, come at 5:30 a.m. the next morning. We met him in a small street at the foothills of Arunachala. And I'm wearing my shoes, my jeans, t-shirt. I had a small bag with little chocolates and one bottle of water to avoid hypoglycemia and dehydration. My daughter was wearing her shoes. My partner was wearing his slippers. He's a professional climber. He climbs the Himalayas. So this was a tiny little hill for him to climb. And there was Mani Anna with a tight veshti around his hip, no shirts, no slippers. He says, this is my God, this is my mother, and I will not use slippers. But then he said, it's okay, this is something very new for you. You can wear your shoes. And thus started our climbing process. Very quickly, a few words were exchanged, and Mani Anna became the mentor for my daughter to climb, and my partner was my mentor. Just like that, walking on a road, Mani Anna started climbing the mountain. Large steps, confident steps, very casual steps. Just behind her, behind him, I see my daughter exactly mimicking the steps, very casually following him and climbing up. And then came the most difficult person, me. I have to apply logic. Every lesson taught about injury, fractures, physiology, bleeding comes into my mind. High altitude physiology, vera. Okay. It's only for 800 meters. And then I have my mentor who is my partner. And then he says, "Illa, it's okay. You climb, you climb, you climb. Inda vandirchu, anda vandirchu." If you understand Tamil, then you get me. All the while, I had questions. How far have I come? It looks so steep. How will I go down? Will the climb backwards be easy or difficult? How much more to go? Will I be able to finish the climb? Will my blood sugars be okay? A number of questions. The person who stayed quiet the previous night literally troubled the mind of my mentor with so many questions. He was patient enough. He has seen so many people climb, and so he said, keep going, it's manageable, it's doable. I'll let you know. I'm watching you. I'll know when it isn't possible. I'll get hold of it. And thus we climbed. At this point, I'd like to share some simple lessons which I observed as a mentee and a mentor while climbing the Arunachal. Beyond the academics and the traditional or conventional teaching, you must have to be a role model with the expertise, with the wisdom, but you must be approachable. When I saw my daughter and Mani Anna climbing Thiruvannamalai, Arunachala mountain, there was hardly any conversation between them. Whenever he saw that she was tired, he would just sit on a rock. She would sit on the rock next to him. They would just smile. And then after a few minutes, he will say, ah. And then she'll get up and then she would continue. It was a totally different scene between me and my partner. You may have profound insights in the field that you are teaching, but keep it simple, practical, and honest for the mentee. Be an efficient guide in the process of self-discovery. There were so many times I was being told, both by Maniana and my partner, don't use your hands, just use your legs. Look up and climb. But honestly, I couldn't. I had to use both my hands and lift myself up. There were times I told them, it's okay, I know I can do it, and I pushed myself. At those moments, they stepped back and they allowed me to do what I could do. So, as much as you are keen on supporting, do not impose or do not hinder the mentee from doing what they want to do if they are too sure about it. So did I climb the Mount Arunachala? Yes. After 5.5 hours, I reached the top of Arunachala, exhausted, empty, literally nothing to think. For a person who clicks every little thing as a photograph, this is one of the worst photographs I would have ever taken. I had no energy in me. I was not inclined in clicking anything or preserving any moment. I just wanted to be there and soak in the moment. And what happened was Mani Anna told me, we cannot stay long here. We can stay for a maximum of 15-20 minutes. And so I decided to just soak at the moment, exactly the place where the DEEPAM is lit every year. And at the end of which I had a lot of thoughts. Those 20 minutes at the top, before we started descending, gave me a truckload of experiences. I'd like to show you 2 pictures that were clicked at the top. My daughter, after having climbed, was so curious about sitting at the edge of the cliff. Well, I am so terrified. If I cannot look from here to there, I'm really scared, okay? So I was not interested in looking at the panoramic view. I was not looking at sitting at the edge of the cliff. So she chose my partner, who took her carefully to the edge, made her sit there, and gave a beautiful overview of Thiruvannamalai and beyond. After some time, she came running to me. You can see how carefully I'm sitting with the rock in front of me so that even if I fall, I will not roll and go beyond, okay? So I'm sitting there. She comes and sits back to me, and then she starts talking about something totally different, about Ramana, about what is spirituality, about what is enlightenment, why is he called the enlightened one, what is death, what is soul, And we had a beautiful conversation for about few minutes. So it is the same mentee there, but can reach out to different mentors for different aspects. Be ready to let your mentee go to another mentor if you are not an expert in a certain field. This is something that I have noticed, especially with PG mentorship, it gets a bit tricky. We get so attached to our postgraduate for the process of about 3 years that we do not want to let them go to another mentor. So we are all different. And I think that's what makes us beautiful. Our mentees and as mentors, we are all very different and we need to embrace our strengths and weaknesses. What can a mentor do? With a lot of pre and paraclinical faculty sitting here, we can introduce the wow factor to them. We can share our experiences as a medical student, as a first year student, and spike up the curiosity in them. But from second year onwards, when they start seeing patients, is where the true beauty of learning medicine as an undergraduate comes in. So make sure that the student doctor training and the shadowing processes are taken seriously. Help them to answer questions like I see, I think, and I therefore wonder. They have a number of reflections that may look silly to you, that may look very trivial to you, but be patient, be open-minded, listen to them. It will instill confidence in them and help them be prepared for the days of their clinical practice. This is something I thought I would like to highlight. I read it in a paper which says that before choosing a specialty, allow your students to undergo observership or shadowing with the relevant specialty teachers. Or for undersubscribed specialties, say for PMR, physical medicine and rehabilitation, MD in sports medicine, or for a super specialization in certain fields, allow them to undergo observership or shadowing under the concerned specialty for a period, and then they can take the decisions based on understanding the pros and cons. Here, I'd like you to read this testimonial shared by one of my students from the 2015 batch. She says, when I initially joined as a junior resident in plastic surgery, this is after finishing her internship, for 6 months, she took up a voluntary observership in plastic surgery. I felt incredibly welcomed and warm. I gained enormous practical skills and knowledge. The freedom of speech everyone had without hierarchy was great. I witnessed how happy everyone was, irrespective of the sometimes longer working hours and unexpected increase in workload. And that quality is something I wish to put into practice someday. So the girl had an observership period of 6 months, and today she's at the UK practicing, she's studying for her surgery. So increasing interaction between specialists and students, such kind of initiatives facilitate learning through constructive feedback and career counseling. What more can a mentor do? I'm sure all of us would have guided students for their research projects in their publications. In the nice to know aspects, most importantly, we can teach the hidden curriculum in all these areas where they explore beyond the routines. The ethics, sometimes they learn from us also who they do not have to be. Okay. And I see sometimes, like a mic doesn't work, or, the slides don't move, or some kind of a technical glitch happens. 250 students are observing how you are handling that moment. And many a times when you handle it in a calm and composed manner, it is easier for them to fix the issue. It is also a permanent lesson that you teach, that you do not have to be so worked up when things go wrong. Things do go wrong, and it is okay to make mistakes. Is a huge lesson that we teach our mentees. So I'm imagining this is me, okay, the first one. And my current students, I imagine them to be the one with this little ponytail. There is a generational gap. I was talking to Deepti ma'am yesterday during the dinner, and we were all sharing that mutual anguish of how well we used to connect to our students, how we are not able to do that currently. And they are too hard to satisfy, impress. I saw Kirubakaran sir telling that, jokes are no more jokes. They don't laugh. There's only a mild laughter in the class. It's very hard to impress them or entertain them. They are very less attentive is a common thing that we tell about them. Less attentive in our classes, less curious, too many teachers, digital, besides the physical teachers, too many tools. They have so much to do and so little time. So I'm going to present two testimonials, one of Akshaya and another of Jeffrey Mano from the 2021 batch. I connected Akshaya to Shriban and Jeffrey to Anish when they came to me with a question that was very similar to the question asked by a mentee few years ago. So this is Akshaya. She says, I could talk to Shriman about both academics and non-academic problems like travel time causing tiredness. I didn't worry about the impression I'm making. Usually if it's a professor, I fear a lot. I felt more like talking to a friend. However, I'm unsure if I'm completely getting the right details from a senior. A professor could be more experienced. Look at what Jeffrey has to say. I was mentored by Dr. Anish from 2014 batch. I think it was really helpful. He could relate to the struggles and the advice that he gave was easily actionable. Also felt more like a friend than a mentor. This is when I want to talk about something called near peer mentoring, where senior medical students can act as mentors for junior students. Has its pros, has its cons, but then papers say when they are self-selected or when we select them carefully, they can act as sensible mentors to their junior colleagues. Gen Z is teaching the workplace, isn't it? Many of us are very proud of our students who are organizing the audio arrangements. Like Priscilla was thanking the student committee members who are doing a great job in the arrangement of the hall and all the games, everything, entertainment. They are teaching the workplace, and there is a clear rise of reverse mentoring. So in reverse mentoring, a junior employee, a person in a junior role, tries to mentor the senior person there. As shown in the picture, the more junior person can share his current experience, current perspectives, newly learned tools, and newly learned techniques, while the senior mentor can share his age-old experience, the wisdom gathered over time, and the judgments because of all the experiences and all the years that he has spent gathering those experiences. Mentoring in special circumstances. It is very hard for me to use the term poor performers. They are academically poor performers in a certain assessment is what I would like to call a student who hasn't scored marks. But papers say that one-on-one mentoring has done a great difference has made a great difference to certain children who struggle with the process or technique of learning in a medical college. As physiology anatomy teachers, we sure always face students who move from the school to the college and find it so hard to even see the size of the voluminous textbooks. And then we sit with them and break it down into chewable pieces, and then they pick up and they start learning. And many a times when we see them later, 10, 15 years later as a successful surgeon or as a successful teacher or a researcher, for a moment, you pause to think how much this child struggled to pick up the book to start reading a chapter, and look where he or she is. So one-on-one mentoring done in a very sensible way always makes a huge difference to the academically poor performing students. Underrepresented communities of children with physical disability, children with learning disabilities, children with altered sexual preferences, they are having a hard time. And it is our responsibility as senior mentors to practice mentoring for inclusion and support the policies that encourage inclusive mentoring. Speed mentoring or mentor dating is a concept that I just like to highlight. We once used this for our final year students who are entering internship and when they finished internship to make a career choice. So this is a hall full of tables with people with multiple specialties. And there was a timer that was kept and people just moved from one table to another table to another table and they clarified their questions pertaining to career choice or, choice of the post-graduation branch. Very specific requirements. So, is fatigue common? in mentoring? Yes. For the mentee, sometimes it becomes very tiring with a certain mentor. And it is added with the confusion of the age, with the distraction of the age, and the disinterest that comes in and goes. For the mentor, I think it is even more tiring. Sometimes you feel it's a thankless job. There are some mentors, I was having a word with the ma'am sometime back, and she was telling people ask questions. This was not charted out in our roles and responsibilities when you employed us. There are colleagues who ask, we are not paid for this in addition. Okay. Everything is valid. Every opinion is respected. Sometimes you feel it's a thankless job, especially when they walk past you and you smile at them first. And then you realize, I have taught this student, but doesn't the student recognize me anymore? Or they walk through you like a wall, okay, or as if you didn't exist in that place. Sometimes there's lack of results. You try so hard with the mentee and that there are no results. And sometimes you're unable to establish a connect. They just come for the mentor-mentee meeting. Yeah, ma'am. Okay, ma'am. No, ma'am. Any problems? No. Oh, okay, yes, ma'am. Study any difficulty in study? No, ma'am. No. Finish quickly, run to the canteen. Okay, so we are unable to establish a connect. I want to share this testimonial at this point. One of my postgraduates, he created this Ghibli art for me when he left and gave a letter, and I've put up a small part of the letter. This was a student who used to come regularly for my opinions, for my suggestions, every day almost, but will not follow anything, will not update me of anything. But when he walks into the room, I will feel very, sad not to say something right to him. There was a point when I thought I should take a step back. There was a point at which I thought I must tell him, what's the use of me telling all of this? Nothing's happening anyway. Luckily, I didn't. And I think I would think many, many times before stepping back from any mentee because of this letter. You have this rare gift of listening, not only to what we say, but also to what we fail to express. For someone like me, the student, who has always found it tough to communicate, that empathy is priceless. You get me, ma'am, and that simple recognition has been transformational. And I thought I would think 100 times before I decide to step back from a mentee after reading this letter. So if you feel fatigue, you are not alone. It is quite understandable. I relate to you as a mentor. It is extremely tiring at times. Pause, recharge, realign. We are the elder ones here, so let us be more kind and let's keep going. There is no immediate gratification, especially while mentoring the current generation of students. Delayed gratification, is it there? Oh, yes, a lot. This is me with my mentor, okay? And she is, the person standing next to me, green sari, Dr. Matangi ma'am, and Dr. Priscilla Johnson. She's not in this picture. I think she's cut on this side. 15 years later, after being a student to Priscilla ma'am and Matangi ma'am, I got a chance to co-author a textbook along with them. So I think it is worth being a mentee to them every bit. This is a student who shared a post on LinkedIn, which I woke up to a few months ago. He's a student from an institution. He's a 2015 batch. And this post comes somewhere in 2024 or 2025. And he says, I'm excited for the bittersweet symphony moment and eager to share my learnings at Emory University. This is a milestone that I dedicate to my mentor, Pratibha, who first identified my inclination towards public health and supported me all through the journey from my undergraduate days. This is not to blow my own trumpet. This is to tell you, I found it so hard to tell this student that he had so much difficulty in interacting with patients. He found it so difficult to read medicine that he struggled to pass every time an exam was there. It put him under a great deal of stress. But I always found him very happy in the pediatrics ward, in a health camp. So I asked him, why not try Masters in Public Health? And about 10 days ago, he came back to meet me again. He signed up a patented product of him to assess wound healing in the community with the IIT. And I thought that the journey with him is completely worthy. And it's a journey that keeps going on and on. So they reach out to us for things that we do not imagine or we are prepared at all. How long can mentoring go on? So here I am, 2005. She was my mentor for my post-graduation, Dr. Priscilla Johnson. 20 years later, I'm sitting as the head of the department in the department where she is the senior professor and she's also the associate dean of the institution. And I'm sure we are gossiping about somebody and having a light moment there. Okay. This is 2005. I was a postgraduate in Sri Ramachandra. I was a table teacher to this boy and who had difficulty in studying, helped him, bag a little grant in the university and win a project. He was very particular that I come to see the baby when the baby was born. And then 10 years later when I met him, so the three of us tried to somewhat recreate the picture. So this is this is when the baby was born, and that's when the baby is 10 years old. This is a picture from a previous institution where Priscilla's daughter read. I had the joy of teaching a beautiful student a few years ago, and I had left the institution, but when they saw me, they came running to me, and it was such a joy to see them. You do not have to be physically present in a place to mentor and leave an impact. In the era of social media and connectedness, capitalize the digital availability of your mentors and mentees and stay connected. So, ending with Ramana's teachings on mentorship, authentic guidance is where you help the mentee to travel a journey, a growth-oriented journey where they understand the self with your silent presence, sharing your wisdom, and guiding the mentees to discover their own truth by not imposing or hindering themselves. And I found this word, authentic guidance, extremely beautiful. Now, at the end of all of this, there are a few people here and there are a few people online. If you tell me, I don't relate to what you say, I'm not a person like you, and I cannot mentor in any which way that you've been speaking about for the last 30 minutes, then I say there is no single best right strategy to mentor. But I can put a few points out of my personal 2-decade-old experience of being a mentor. Stay open-minded, but clarify expectations so that you understand your roles clearly and do not end up with a misunderstanding with your mentee. Support the mentee, but let them evolve and let them go if in case they want to be elsewhere. Challenge them, but with care. Like I told you, you are the elder one here with more wisdom. So challenge them, push them beyond their boundaries, but keep a careful watch over them. Create safe spaces, but set your boundaries. Model vulnerability, be authentic, share your personal experiences, but remember that it is an extremely professional relationship at the end of the day. So, the mountains humble you. So do your mentees. They come with a whole range of questions to answer, problems to solve, and expectations to meet. The burden is heavy, but if you can build trust, and like how Ramana and Arunachala illuminate our path, if you can illuminate their path, together, mentor-mentee relationship can be a dynamic one where you can reflect, grow, and transform mutually. I would like to read this slide and end my presentation. To each one of you mentor who is present here, I call to action in the land of light and self-inquiry. Let us commit to mentorship that honors both ancient wisdom and contemporary challenges by integrating the principles of self-inquiry, presence, and compassionate guidance with evidence-based practice. Let us create transformative relationships that nurture not just skilled physicians, but whole, resilient, compassionate healers. Because the potential within each mentor and mentee is infinite. This is how it looked at the end. There I am, lying completely exhausted and very greedy because I had only a few minutes and the descent has to begin. So I thought I would lie down and let every cell of my body take the mountain inside of me while I have a little distracted one next to me. And that is just the snapshot of the first long bike ride that I happened to do, about 171.3 kilometers. When I look at this moment, and if I ask the question, is it worth it? Is mentoring worth it? Totally. Thank you very much for the opportunity.
Ma'am, it is really worth it to listen to your lecture, ma'am, your speech. It is really, really worth it. We all really enjoyed it. You have literally mentored us to continue mentoring, our mentoring, ma'am. Thank you very much, ma'am, for coming all the way and to share your experience with us. Thank you. Thank you very much, ma'am.
Thank you, ma'am. Your session is very mind-blowing one. And you're coming from by the bike, madam? From Chennai, you are coming from bike? That day, okay. So it was just like a definition of the mentoring. Mentoring is nothing but sharing the experience by the senior to the juniors. So the way the madam did is just to share their experience by coming she has some clicks. That is very impressive one. And that is also reverse mentoring also happening. You will learn so much of things from your daughter, I think.
Yeah.
So actually she's a mentee.
Absolutely.
So the process you have explained is very bright, madam. So as a mentor, as per definition, we should be a guide, a coach, a friend, a facilitator, and a role model. So it is an excellent class. Thank you for giving the chance.
Thank you, sir. Question. How to record the mentorship in paper? Sun TV தெரியுமா இதுல அப்படின்னு கேட்பாங்க இல்லையா ஒரு ஜோக்ல. Have you seen that joke? Vivek will have the comedian, late comedian Vivek. He'll have a little bit of few people around him, and he'll operate and say, "Idanda computer, ivalanda computer." There'll be one Sun TV தெரியுமா இதுல அப்படின்னு ஒருத்தர் கேட்பான் அதுல. அந்த மாதிரி how to record mentorship in paper for NMC purpose? Yes. Each institution has a different way of documenting it. I will share the experiences in Ramachandra, where we have a mentoring committee headed by a professor in the Department of Anatomy. And mentors are identified for the longitudinal mentoring. The students are allotted to them in the ratio of 1:3. And the mentor-mentee meeting sessions for the entire year is already planned at the beginning of the academic year. There is a WhatsApp group with all the mentees. Reminders are sent, and there is like how we had a huge hall for lunch. There is a huge hall which is allotted for the mentoring sessions. And 2 to 3 p.m., each mentor has to go meet the mentee. And then there is a document which has a set of questions on personal growth. I mean, first it starts with the marks of the previous exams, with the attendance, and then other questions like, about the health. If they are a hosteler, there are certain questions. Any personal problems? Do they need any other counseling? The mentor fills it, signs it, and the mentee also has that a document of the logbook along with them. Now, once it's done, all the mentors report in the group that they have done it. The mentors who were absent for the mentoring session, or the mentees who were absent because of certain unavoidable reasons, they are supposed to finish up this meeting in the next 2 to 3 days. And by the next, usually it's on a Friday, and by the next Thursday, the report is submitted to the medical education unit. It happens very rigorously at Sri Ramachandra Medical College, but I've been in earlier institutions where I was also discussing with Deepti ma'am that there are certain practical challenges in getting the mentors to come and do the mentoring, in getting the mentees to prioritize that session and go to the mentor. Challenges are many, but taking inputs from Sudha ma'am's lecture, let us do an appreciative inquiry of what we have and how we can lead change in that area. I hope I answered your question, but for a detailed form, you could probably email to me and I could share the form with you. Thank you so much, people. Thank you, everybody, for your patient listening. Thank you.
Thank you, ma'am, for your enlightening talk, ma'am. Your clarity made a real impact on us.